On our way to my third round of chemotherapy treatment, and
yeah, beep 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 to you too.
yeah. So it's 0800 hours. Well, to be exact, it's 0803 hours, and 6 October or 7 October.
7.
It's 7. Yeah, 7. Wow, I'm really losing time
No,
here.
it's not 7. It's 8:03.
Yeah, yeah. Okay.
Thought it was kind of funny.
I guess you have to be there.
You are.
I guess you have to be there, yeah.
Yeah, you're sitting right next to me, so you are
Okay,
there.
why is this? Oh, maybe I'm holding up too high. Well, I always look like I'm cutting my
Like you're
my
a
show.
floating head.
Yeah, like a floating head.
Look, watch, bobblehead. See?
Weebles wobble, but they don't fall down.
I don't know. Never seen them.
Okay. That's the one thing with having the port on my my right shoulder. Well, it doesn't matter. Even if I was on my left shoulder, it would be a problem, irritating because of the seatbelt. And you don't want to put a lot of pressure on that from the outside, like a seatbelt, because it's it's not like it's not like it's bolted to my bones. It's very close to the, it's just underneath the skin, so, and because of the way things are on my body, they're able to do it, but they have to find different ways to do things, because there was a lot of damage, because the way I was injured years ago. It's another long story. But anyway, now what this is all about. So, waiting to get through traffic here, rush hour. But yeah, going to my third round of chemo treatment. Don't expect anything different. Hopefully I get to see the doctor today and see what's going on. There's one particular treatment, though, that the insurance company won't authorize. Anyway, I'll add the updates as needed after I get out of the infusion center and after I've talked to the doctor. That's about it for now. Just kind of like get things started for today on this particular video. Old delivery van. Wow. Wonder what year that is. I like the old cars.
Look like they got an old pickup truck there.
Yeah, there's an old pickup truck over there.
Like green, blue.
Looks, yeah. Hard to tell because of the rising sun.
Like the house of the rising sun?
No.
No.
No. Oh, yeah, another old car is gone.
Yeah.
Oh, it's in the shop.
Oh, yeah.
Wow, that sun is bright. Morning sunrise on the East Coast. Oof. Okay, that's better. That's why, this is why it's always good to wear a hat with a brim, even a little brim like a fedora. You know, I forgot who was it. I think it was a nurse somewhere. They told me that with the hat that I wear, I guess because of the feather that's there, I should be in the Alps yodeling.
Oh, like your Ricola?
Yeah, yodeling.
Oh, God, no.
No, I can't do that. I can't yodel. So anyway,
Wellington, please. What the hell am I doing? There's a
yeah.
guy up there. Don't jump. There's a guy on the billboard.
He's probably putting up a new ad.
Oh, don't jump. You can see him.
I don't know if you can see him.
He's not there. Well, he's there, but
Yeah, there he is. You can see him up there.
Pop his head up.
Yeah, he's working on a billboard. So, no, I saw those old cars over there, so I just wanted to quickly record them. Just to show, while I'm not from the 50s, I kind of 40s, I should say. I'm not from the 40s and 50s, but I feel like I probably was reborn, if that's even a thing.
That was your previous life.
Yeah, previous life. Because I really do like the music from the 40s and 50s. And I guess you could say I got hooked on it from playing Fallout 3, the game, and Fallout 4. I've watched this TV show, Fallout, but I mean, it's not bad inherently, but it's just the way they started it. And it's just the way that it was started. It's not the way. If you're going to follow the storyline within Fallout, but the thing is where they taking their cues from? Fallout 3, 4, 76, or Fallout 1 and 2. So I don't know where they're getting their storylines from. It's off. It's off. Ball and chain. So we're approaching the hospital. Well, the area that the hospital encompasses, and where the cancer center is. So we're almost there. I'll get dropped off by Ball and Chain, and she'll go to work, and then pick me up. It's pretty early today. Wow. You know what? I just noticed something. There's a crossing guard over there, if you can see him. I can't really zoom with this camera because of the way I have everything set up. But he's an elderly gentleman. I mean, looks about maybe a little older than me, maybe by 5 years or so. And it really is amazing that somebody that old has to come out and make a few extra bucks today. Now, maybe it just could be, I don't want to sit around all day watching soap operas, and I'd rather be busy doing something, which is good, because when you get to the point where you do retire and all you do is just lay around watching TV or soap operas, however you watch it, your video entertainment, you tend to waste away. So that was an assumption but there are a lot of people that are a lot older than me that are going back to work, finding ways to make more money, some extra money, because they just can't make ends meet. And I guess the ball and chain and I will probably be doing something like that when she retires in roughly 3 years. Because just going food shopping today is outrageously expensive. What we spent in food shopping last week, I go back 20 years, I could have done that for a whole month. That's how much money for 1 week. What are we doing? Oh, you're waiting for a parking spot. Maybe they're not parking. Maybe, she's just sitting on her phone. Okay, so talk about going off track. I don't even know what I was talking about before. Okay. Yeah, the one place they give you free parking, the cancer center. Okay, so I don't know what I'm going to be able to do while I'm in the center, but we're here, and I'll update with more information, as I said earlier, when I can. And see you later. Yeah, the new look. They're about to do the blood draw.
Oh yeah, his tape finally came off.
Yeah. Okay. Watching a little bit of Motor Trend and an old show, Phantom Works, while I'm getting my pre-med treatments, steroids, and my cocktail of medications. There's all my medications. This way you see me. You look at me. So, just a quick little video while I'm in here doing the treatment. And once all of that is gone, then they'll give me my chemo brain treatment. Well, it's not for the brain, but um, I'll get my chemo treatment. Okay, more updates to come in a little bit. See you later. Well, what time is it?
1:45. Going on 10 to 1.
So it's been almost an hour, and I got my chemo treatment going. Here we go. So the chemo treatment's going. That's that orange one that you see here. This orange one right here, and along with the sugar water. That's the only thing I can work with. You can't use saline, and steroid and everything else. I think has already been administered. So here we go, and we got roughly another hour to go, and then I should be out of here by 14:30 hours. And behind me, that's a shade. Um, don't look like it, but it's a shade. I can promise you that. And they put me in a corner.
They put baby in the corner.
Yeah, they put me in a corner of the infusion room. Oh, gimbal reached endpoint. Yeah, so they put me in a corner. Well, and
You see, because you can see the difference. The shade is down there. The shade's not down there. But when you're looking when it's looking directly at you, it looks like there's nothing there.
yeah,
It really is
God, that is amazing. It's a funky camera.
weird.
But anyway, the only thing they forgot was the dunce cap. They forgot to put the dunce cap on me.
I'll put it on.
Yeah. Yeah. Oh, thank you. So just another little update. See you in a bit. This is one of those shows that recording. No, this side.
There's a red light on that side.
Yeah.
Green light on this other one.
It was one of those shows I kind of liked. They came to your house, came to people's houses to do the car resto, but I don't think they make anything new anymore. But sitting here in the infusion room, using my daughter's tablet. That's a nice car. It's old. They don't make cars like that anymore. So, hooked up to the chemo. It should be done soon. A little bit more to go. Not much. There's one right there. That one there. And then you gotta do a flush with that yellow bag up there. And yep, and then I'll be out of here for this session. Number 3. Okay, I'll be back with more updates in a little bit. See you then. Okay. All right, well, all hooked up with my little chemo ball. And the way it's all hooked up. And all ready to go home. Okay, I just want a quick update. All right, see you in a bit. Okay, in the car and on the way home. Finished with the infusion center
At 2:44.
at 14:45, and right lane. Yeah, right lane, Clyde. Oh, I should say right lane ball and chain. Anyway, everything went well as usual so far. Um, uh, I guess I'll do another update later on. I'll show you. Nothing. It's basically the same thing, with the chemo ball and the wonderful pouch they give you. It's so cheap that you could probably make one yourself. That's even better. But anyway,
Did we bring that one this morning?
what, the pouch?
Yeah.
Of course, gotta bring it. Well, what am I gonna do?
No.
Walk around with the? You know what? I'll walk around with the ball like the ood.
No,
You know?
I didn't know somebody grabbed it.
Yeah. So, I mean, everybody had a better attitude today. They were more smiles than frowns. They all had a good sense of humor. This time, actually, somebody got the. How would you put that, Samantha?
What?
When I call her hot lips, the reference, because when they do certain things, they have to get the head nurse to come over and verify name, date of birth, and all of that, and what medication is being administered. And so she came over. So I said, "Oh, so you're the head nurse, huh?" She goes, "Yeah." "Oh, okay. So thank you, hot lips." And they both giggled a little bit. I'm like, not sure if you got that reference. And actually, the nurse that was there for me today, she got it from the show MASH. It seemed like there were less people there this time. Maybe because I came so early in the morning. But basically, the same thing as last time. And for the most part, there's really not much else to update on because it's not like they did anything different. Ooh, that might have been that. Oh, they're digging. Oh, you know what? They're doing more planting. Sorry, you got sidetracked there. So,
One more chemo treatment.
and yeah, so I'll get more into more updates, more information with what the doctor and I talked about with my daughters, and I'll do that when I get home. Probably later on. Well, maybe I don't know. We'll see how everybody feels. I actually dozed off this time in the infusion room. I'm surprised.
It's because you got up earlier.
Yeah, could be. Yeah, got up a little earlier today, but yeah, it's pretty much the same as the last update. So I'll see you later, and a little bit more information. Not a lot, just what the doctor and I talked about. It'd be nice if I could at least get them on audio, not because I don't want. If I was able to, I would never do video, no names, no nothing like that, because in my mind I would be doxing, and I don't want to do that. So, but I don't think I'm going to be able to. There is one more treatment that I have to do, and then might be doing. Well, you know what? I'll save that for later when I get home and do it with the more relaxed setting. Ooh, there's the old car. Look, I want to get the old car. Ooh, the old car.
That's a nice car.
Yeah, that is. Okay. Whoa, a little close. That was a little too close for the camera. Okay, so see you with a little bit more information in a little while. Take care. Okay, today is 8 October. I want to go back a month. Day after my first of 3 days of chemo treatment. Got my little chemo brain ball, or ood ball. But I've been having a lot of, not a lot, but some discomfort where the port is that I've shown in prior videos. While everything went pretty smoothly when they tapped the port, getting the treatment yesterday, the 7th of October, they called up the surgeon. They did the operation, and they called me back, actually surprising, late in the afternoon to tell me to come in and see them at 10:45. And kind of surprised that I know I said it once, but that was fast. I expected, oh, well, come back in next week or whatever. No, but I don't know what he's going to be able to see. It's even if I see him, the doctor or a nurse or whoever, because of the way the port is covered up, protected, if you will. So everything stays in place. Again, I'm all taped up so the tube doesn't get all bent up and kinked, because if it gets kinked, then the pump won't work. And again, it's the same type of pump that works off my body heat. They do have other types of pumps, but it also depends on your form or type, how severe the cancer is. Because my one daughter that was sitting there with me in the infusion room heard one of the patients talking about a pump that is actually mechanical and rechargeable, or something like that. But that's, again, I know I'm repeating stuff that I've already said, but again, the 46-hour chemo treatment that I have to go through every 2 weeks is tailored to each individual person after each blood draw. So they actually took 3 vials of blood when they tapped the port, and they took one more, which I don't know why they didn't do it all at one time, but they did another blood draw before they started the cocktail of treatments in the infusion room. Because again, if you haven't watched the other videos, when they do get posted, they have to use sugar water. Can't do it with saline. Then they add steroid, and that pumps up the blood sugar a little bit. So I checked my blood sugar this morning. It was 317. I did have a little snack last night, but it's kind of like quasi unsweetened pastry. It comes from Italy, I think. It's really small. I mean, you can eat it in one bite almost. So I'm trying to follow what the dietitians are saying and eat 3 meals, snacks in between meals to help stabilize my blood sugar. But it's really hard because of what I'm going through right now with the cancer and my blood sugar. It's getting hard. And on top of that, I'm starting to use it. I started using insulin. And today it's really been really rough on my fingertips because, well, not on my fingertips, but just on me as a whole. And I actually felt it when I was leaving the infusion center. Anyway, because we're a one-car family, I took my wife to work so she doesn't lose any more time because she loses time every time I have to go for my treatments, to take me there, then pick me up. So she loses time from work because of the way our new year started. So I know I'm bouncing back and forth, but as I've said before, there's just so much to unpack. And hopefully I don't have to go in for another fixer-upper operation. Ooh, look at, there's an old Chevy, the black and white one. It'll probably be there when we go back the opposite way.
Probably.
So I don't know we'll see what happens when the doctor gets there. I know I cut myself off on what I was saying.
Shiny thing.
Yeah, well, not so much shiny thing. It's just, there's so much going on in my head and I can't do scripts. I just can't. I turn very robotic when I read a script because, I don't know, it's just the way I am. There's a lot of things that I do off the cuff, and it's already been proven. You won't see any of those videos up on YouTube, but that's about it for now. I'm on my way over to the doctor's office, which is another building next to the hospital. See, so are we an hour early? It's at 10:45.
Yeah.
Yeah. So
we left the house early.
yeah, we did. Because I also want to go to the see if I can talk to the social worker again about helping out with some of the bills that we're getting, especially public service. It's gotten really outrageous. So I don't know how much how much assistance I will get because I have to take into account all income, household income. That includes my special needs older daughter who is on permanent disability. It's just all the little bills that all add up, but I don't know what they can do. There's a lot that the woman told me about yesterday that they could do grants and help out with the gas electric bill, but that's only a one-time thing that they give you. It's not for the entire year. It's not like they give you X amount of money every month or every 2 weeks or whatever. It's one time and that's it. Well, that's something, right? You don't get that, doesn't get paid back, but I do want to go back and see if I can talk to her a little bit more. But at the same time, I do valet parking at the doctor's office, and it is a madhouse. It's like they're giving something away for free. The way people pull in there, it's like unbelievable. And the later you go in the day, the worse it is. So I'm just going to swing by the hospital here real quick and see what the valet is like. Really not looking to sit there for an hour waiting for the doctor, but maybe that might not be a bad idea. I don't know. What do you girls think?
That actually may not be a bad idea. Yeah.
Because I mean,
Because if you do end up going to talk to that social worker, you could end up
right, not
running late for the doctor.
Correct. Yes.
So let's just see why.
Well, yeah, maybe we'll do that because, I mean, the last time we had to go do a follow-up with the doctor here, we waited a good hour, I think, before we got to see him. We waited quite a while. But anyway, all right. See you in a little bit after I get a bit of an update. Okay, just came out of the doctor's office and he doesn't see anything wrong. We had a picture taken yesterday to show before the port was tapped. And even by looking at it with the way everything is covered up, said he doesn't see any problem, but it could be a little bit of scarring. So stretching out a little bit and, you know, would not be a bad idea every so often because that could be what's happening, but he sees nothing wrong. And ironically, we were just joking around, but because my concern was that the port would be tilting one way or the other.
It's shifting.
Right, well, no, tilting, not shifting. And it looked like it was tilting more towards the right as I'm trying to imitate with my hand, and he didn't see that. But he goes, the way he put the port is installed, it's actually screwed down into the tissue underneath the skin, like the muscle area. And I said, and I asked him, seriously, what'd you use, zip ties? He goes, basically, you're not far off. That's about what we did, because if you don't secure it, the port would flip over, and then that would be a problem. It would be another operation. But otherwise, the port is securely fastened. So I was having discomfort, what seemed like almost like a pinching, stretching feeling. And I didn't have to pay a copay because it was seen as a follow-up, which is good for me. Okay, we're waiting for my car for the valet driver to bring the car over. So there'll be more updates coming. See you soon. So we had to get our bearings here because a lot of information, and really for the most part, the treatment was no different than first two treatments. It was basically the same thing. So I got my chemo ball in my little pouch thing here. And then you can see the tap over here. I don't know, you're not gonna be able to see can you see the date?
Kind of.
Let me move that.
That was not me.
Yeah, that was me. Can you see the date? I've been date coded. 10/7/10/25. That's the needle that goes into the port. And I know we've done this before, but just a little bit more close up while it's actually attached to me.
You can see the scar as well.
Pull this.
Yeah.
Yeah, so this has been, it looks like the tape is coming up again.
No, that corner was like that last
yeah,
earlier.
Top is starting to peel up a little.
But it is?
Yeah, right.
Just
where
a
my finger
little
is.
bit where it's like.
See my finger?
Yeah. Right here.
But we'll have to put some tape on it so it stays. But this will be off on Thursday. That'll be the 46 hours they're coming.
Yes.
After speaking with the doctor and and talking to the chatty one, as they refer to her, I guess she talks a lot. I don't know, but I got a bill from my health insurance, or the health insurance I'm covered under, and there's a couple of items that were considered after I called the insurance company. And my biggest thing was I called the oncologist 3 times, not 3 times, at least 2 times, maybe 3. But either way, they never called me back. They said, "Well, have somebody call you back." They never called me back. When I went back there, the first person I see is the chatty one. She's the doctor's assistant, and I'm showing her this stuff, only the ones that are highlighted, because there's stuff on there with my wife that has to deal with my wife when she had to go for physical therapy after getting out of the hospital. And it's technically not a bill. It's just a list of all of...
It's not even technically, it is not a bill.
No, it's not a bill. It's just services performed and what was paid, what wasn't paid, and if you owe what you need to pay. But right now, I haven't gotten a bill for that yet. But I'm being told that they should not have done that. They should not have shown that as a charge, because when I talked to the insurance company, they said it was an experimental pathology.
Yeah, it was just experimental.
It was a pathology. It was a pathology associates, whatever, where the doctor, the oncologist, sent out, I guess, some of the biopsy, because if I haven't said it in an earlier video, they have to hold on to this the biopsy they took from me, from the esophagus, for 10 years, and it's preserved in such a way that, and then they put it in wax, and they can slice it, almost like using.
On a sheet of paper.
Right. It's actually, yeah. You could probably. I would love to see them do that, because you actually, if it's thinner than a sheet of paper, that means you could see through it. But because I'm guessing they would have liked to have a larger piece of a larger biopsy piece. I'm just guessing here. They sent out some cultures, and according to the insurance company, it's considered. They're seeing it as experimental. I mean, how could you do that? I mean, I'm not the only person dealing with cancer, okay? And there's a lot of people dealing with this. I mean, you know, there's one person that was leaving the infusion center yesterday. When I was leaving the infusion center, he was getting a mechanical pump that had to be recharged, like it was a rechargeable pump. So not everybody gets the same type of thing. I get the heat activated pump, which is just my body heat, but everything is done per patient as the blood work cultures are done in the hospital. So you go to the first floor, get tapped for the blood. They put in a tap, and you saw the pigtail coming down. That's where they hook up the cocktail of medications when you go up to the 4th floor, and eventually get the chemo. They'll also, which I would love to get a video of them doing, but I don't know if we're going to be able to do that, because they give you. It's a pretty big needle. It's not really a needle. It's a pretty big syringe. They attach it to the pigtail, and they give you. It's like a.
She called it a bolus of your chemo medicine.
It's the same chemo that I have attached to me now, but it's almost like a higher dose into the system, and then they attach the chemo.
Right, like to get you started.
Right. It's kind of like almost like a mega dose. It's a pretty big syringe. I mean, I guess the syringe is about, I don't know.
Would you say it's about as?
No, it's about almost the size of that pen, but it's fat. Yeah, it's about the size of this pen, but it's really chunky. It looks like it's about a ½ inch, maybe a little bit, maybe 3/4 inches thick. So it's a pretty big syringe filled with the same medication that the chemo ball gives me for 46 hours. but that's in infusion room. But after talking with the doctor, they usually do 6 to 8 treatments like this, but they're going to try and do it after 4, because I have a feeling that she didn't actually say this, but they're going to I'm going to have to do another set of scans. Now, does that mean a PET scan? She hasn't said that yet. Or is it going to be just a CT scan with contrast? I don't know. But they're going to see how things go after the 4 treatment. Then my daughter filled out a form, compassionate form, because there's a whole bunch of papers I got here from the health insurance company that I'm covered under. Yeah, from what you're seeing here on this page, it pretty much tells the story. I'll read what the request for the service listed above has not been approved. That's what the rest of the paperwork just says. Why are you receiving this letter? Yada, yada, yada. Because we don't feel you need it. Something like this is just a... And it has the doctor's name, my name, reference number, insurance ID number. The service, it's listed as a service. I don't know about service. More of a... it's labeled here on paper as J. John 9271 Keytruda Pembrolizumab Pembrolizumab, whatever. Keytruda, how about that? We just leave it at Keytruda. Yeah, okay, it's Keytruda. It's Keytruda. They want to prove it. It's an immunotherapy to help. Yeah, basically it helps boost the immune system after getting all these chemo treatments.
Well, also while you.
Well, I don't know if they. I don't know. Right. Yes.
It's not only because of the chemo.
Well, yeah, no. Well, the chemo is actually damaging the body.
Right.
Right, and then this is supposed to help boost your basically your white blood cell count, which is your immune system, and that's what this is for. And they won't approve it.
Right.
Really?
Imagine that.
Something to help you get better, they won't approve. The poison that they're putting into your body, which is used to kill the cancer, which is that, no problem. How much you wanted a cup? You want to drink it? Here, have some chemotherapy. Don't worry about it. We'll pay for it. Really? Something that will help you get better, help your immune system, they won't pay for? You know? Thank you for the Affordable Care Act that these politicians have never done anything about. And supposedly they're still trying, who knows. Anyway, you can move that stuff. Basically, the
meat and potatoes of it.
Right. The meat and potatoes of the conversation I had with the doctor, they're thinking about maybe doing radiation, and it's nothing like you go into like a tube for an MRI, because and I even told the doctor, if it's something like that, I can't handle it. Something's changed in my brain over the years, because I have gone for MRIs in the past, years ago, and one time it was for my leg, one of my legs, or ankle or something. Another time it was actually for my head. My neurologist wanted me to get an MRI, and I actually fell asleep during the MRI process. And they used to give you music to play music for you. And I actually fell asleep while they did the MRI. Now I can't handle the machine. I don't know. Obviously something changed, because I just can't do it. It would have to be an open MRI, and there is one in my area, but unfortunately, it's not covered under my insurance. And they also tried to screw me on that one, but ended up paying a little bit over $300. So, I mean, it wasn't that bad. So, but there's some kind of machine that you lay underneath, and it's almost like it's like a beam that's like, beam me up, Scotty. That's what I told the doctor. It's like a beam that they shoot right in the area that your cancer is in, or you lay down on like a table, and I don't know. I guess I'll figure out what it is when I get there. And I keep these. They want to take them off. I keep these bands on until I'm finished with the chemo. Because the last time I had to go back once. I think we did the video on that, right? Did we add video to that? When I went back to, because everything
Yes.
was coming off.
Yes. Yeah. I believe
So that's why I'm leaving the bands on. And it's kind of odd that they do this. They give you one band. They give me one band when I get tapped for the port. Okay, and then they draw blood, and then they send it up to the lab. They do all the lab work, and there's a lot of waiting time in between before you see the doctor, because by the time you see the doctor, they already know what's going on with you, how's everything looking with your blood after the lab work is done. And at that point, they start working on your cocktail of chemotherapy, and it's per patient tailored. But that's what they're looking at. That's what the for me at least, that's where I'm gonna end up going. Probably they're gonna see, because they have to do the scans first. And the odd thing is and I even asked the doctor, I'm like, I don't know how, but the PET CT scan with contrast, mind you, is supposed to light up any cancerous tumor. It's like the tumor is supposed to light up with the PET CT scan after they give you that crazy radioactive cocktail to which is the contrast. The PET scan did not show anything about the lymph nodes, but the CT scan, it saw them, but they weren't completely sure of whether they're.
They said in the CAT scan that the lymph nodes looked a bit. The best way for me to put it is that they didn't look right. Something didn't look right. But in the PET scan, because the PET scan lights up anywhere where there might be cancer, because
It didn't see the lymph nodes.
Right.
So
I'm guessing that's currently okay.
that's what I'm thinking, but the doctor is like, it just doesn't see the lymph. I'm like, how can it not see the lymph nodes? I mean, the PET scan was entire from. Now get this straight, okay? They told me from the base of the skull. I thought the base of the skull was back here, you know? No, it said, no, this is the base of the skull, basically right above your eyebrows. So the PET scan went from here to halfway down my thighs. So that's pretty much the entire core body. And even there, I start to fall asleep. But I don't see how. It's pretty much similar to the MRI type image that you get. It shows the body in slices. So I don't see how they could. And then you could actually put it all back together and spin it around, you know. So I don't get it. I don't understand why that would not show more than a CT scan. Because a CT scan took less than 10 minutes. I don't even took 5 minutes, I don't think. That moves very quickly. But, and that was a different type of contrast. So, this is where their thinking is. After the fourth treatment, when I go back in 2 weeks, after this is disconnected, after this chemo ball is discontinued, I go back to my fourth treatment. Then after that, I guess they'll set up whatever scans they want me to go for, whether they be PET or CT, I don't know. But they do want me to go for, you know, this was a thing. They want me to do another endoscopy, but one that does an ultrasound from the inside out, which I've never even heard of. But I'll go for an endoscopy, and it'll actually, I guess they'll take more pictures of the esophagus, and then where the cancer is on the lower third, they'll do an ultrasound, which is from the inside out, because an ultrasound from the outside in doesn't show very much. I guess it doesn't have enough power to get through all the tissue. So that's why they have the internal scan with the endoscopy. So I'm going to be doing that, and I think that will be after my fourth session.
Yeah.
I believe that's the way she put it. Unless they decide to do it before my fourth session, but that would be a 2 weeks. There's a 2 week span in between sessions.
From what I heard from her was she said that it's going to be towards the end of this month or the beginning of.
Oh, that's right. She did say that.
Right.
It would either be the last week of October or the first week of November.
Right. But I'm going back on what, 21st.
Yeah.
So
it would be somewhere in right after you go for your chemo treatment, most likely, or the first week of November. You'll be seeing her again, so when you see her, you talk to her.
We'll ask. Not only, okay, that's pretty much it from the doctor update. But the one thing I noticed, because yesterday it was raining, it was a bit cold, because everything I drink, even my coffee, is a bit room temperature. Yeah, room temperature. My daughter warms up a little bit, but not a lot. I can't drink anything really hot, and nothing cold out of the refrigerator. Everything has to be room temperature. Even my food has to be at room temperature. It could be a little bit warm, but not very. But when I was leaving the cancer center, just the cold air, because it did cool down quite a bit, I was feeling pins and needles in my fingers, and I was holding a closed bottle of my Icelandic water. It's pretty good. It's good water. My daughter became a snob for bottled water, and it has to be Icelandic.
Full stop. Are we forgetting Mom?
Well, yeah. Her too.
She will not drink anything but Icelandic.
Right. Even though Fiji is also, from Fiji.
Right.
And filtered through the volcanic rocks. Anyway, a little bit of side note there, but it was weird because I haven't opened it when I came out of the cancer center. I'm just holding the bottle, obviously I'm not going to hold it sideways now, and I guess they had the air conditioning on inside the infusion room.
To some degree, otherwise.
I really didn't feel it, but it wasn't cold, but it obviously had the AAC on, but the water was cold enough where I was holding it, I was getting pins and needles, and it's a really odd feeling. It's very different from let's say you fall asleep and you put your hand behind your head, you fall asleep like that, or you're leaning on your elbow and you get that little bit of numbness and pins and needles. It's something like that, but it's very different. It's right in the fingertips, really. It's weird, because I don't feel it in the whole hand. I feel it in the fingertips only. And that's the odd thing. And it was room temperature water that was sitting inside the infusion room, probably air conditioning on, so it cooled down a little bit. But not only that, once I gave my bottle of water to one of my daughters, but just the cold air even gave me that odd like prickly feeling in my fingertips. So that's part of one of the little annoyances from having chemotherapy. Now, maybe not everybody will get that. Anybody that's receiving chemotherapy, they may not all get that. But I still have my hair.
Can you create a mustache when you already have one?
Double mustache. This used to be blonde.
Double stash.
Yeah.
I don't know if I would say that maybe not everyone would have it, because I think that is like a common side effect.
But again, but not everybody will react the same way. Like some people will have to be using like the medication they gave me for anti-vomiting,
right,
anti-nausea.
Yeah, you haven't had to use it.
Knock on wood.
I'm surprised.
That has not been an issue for me. I'm not having any problems eating. Only thing is I have to watch. It's my sugar that I have to be more cognizant of what I can eat and what I can't eat. Oh yeah. Go get go get the blood sugar meter. Oh, you're gonna do it? Okay, you know how to do it? You sure? You're gonna sterilize it?
Watch her take the purple lance. Watch her take the purple lance.
Close the zipper now. Make sure it's at 1.
It is.
I don't need to get it to high.
It's just checking.
Why you gotta hold the top?
It's just the way I hold it. Gives me.
It's not.
I know that. Just give me.
$2.47, and all I had to eat today was I called it hash and eggs. 4 eggs, and basically it's corned beef hash. It's a little can. It was like 4 ounces, something like that. It's really small.
So?
Well, look, she threw the can in the garbage. Yeah, which is the garbage can. How many ounces is that? Because it does have some potato in it. And I said metformin.
Okay, give me. I'll put it back.
No, I want this and the metformin. Well, you're not listening to me. Help!
7.5 ounces.
Oh. Right, so it's a 7.5 ounce can of corned beef hash with very little potato in it and 4 eggs, which is mainly protein. I don't know of any carbohydrates in eggs, but then again, all food will add to your blood sugar. And I have not started to lose any hair up top here yet. I've been losing hair, been thinning in the top for quite some time now. Long
It's
before.
not like actually falling out.
Right, it's not falling out like, hey, oh my God, it's a clump of hair. No, that's not happening. Not yet.
I'd have not lost my mind if I looked at that. It's just hair.
That, you know what? I'd be like, oh my God, help! Half my beard is gone. So, yeah, for the most part, I've been doing pretty good with all of that stuff, and hope to stay that way. And then we'll see what happens around the 4th treatment. And then Thursday, the nurse comes and takes the ball off, and that's about it for now. There's really not much else to say. Everything that I wanted to put into this video is been said. The one thing that needs to be approved right now is the Keytruda, which just baffles my mind. The way the insurance is, and our insurance has changed quite well. It's my wife's insurance that I'm covered under, but it's changed quite a bit over the years. But that's about it. And there'll be another small update because I'm going to see the surgeon that installed the port because I've been feeling a little bit of discomfort a couple of days before I had the port tapped. So I told the doctor when I talked to her, and chatty one as well, and they called up the doctor and they said, hey, you're talking about yada yada yada, and it's okay. They called. That's why I was surprised that they called me back so quickly. And I went in. I'm going in rather. I haven't gone in yet. I'm going in for 10:45. So I'll take my wife to work. But there was also one other quick thing. There was a social worker there as I was getting ready, waiting for to get called in for the chemo treatment. A social worker, and I'm like, I got a social worker? She goes, yeah. I'm like, I don't remember talking to her, but I guess I have a social worker there. I filled out some paperwork, and they'll help with the public service bill, but it's a one-time only payment of $500. And you have up until the 31 December to use that up. And it goes directly to your public service, to pay towards your public service bill. And she put me in for a grant, it was, I think. Mm-hmm. She said we had to fill out some more paperwork. She can only approve 2 people a month.
Oh, no, that approving the only 2 people a month. That was a one-time payable check to you
Right,
to
but
use for whatever.
right, but I think that was somewhere between $250 and $500, somewhere in there, and I can use that for whatever, you know. Like, we'll get a case of water. Don't drink beer anymore. Or yeah, I can get go whole.
Yeah,
I can get $200 worth of Ricola. But anyway, yeah, that's it for now. I'll have another small update, and not much. If you know anybody that has cancer, just keep them positive. Try to be, lighthearted. I'm trying to be as. I know you've seen by now enough of me being goofy, if you will, but as I've said once before, it's either that or, and I'm gonna say it all, and I know it's gonna be repeat and repeat, but it's either that or curl up into the fetal position and just sit there and cry. Because even today, when I went for the treatment, there wasn't a lot of people there, but even the people in the treatment room, they look like they've been beaten down. Now, who knows how long they've been at this? I'm not going to go around asking, but they're too focused. Yeah, I have cancer. I'm not trying to make fun or light of it. It is probably the worst disease that anyone can get. It's just amazing how so many people, I see them walking around. It's almost like zombies, just like, why am I here? Why do I keep doing this? It's like, that's all I could see. That's what it feels like to me. That that's all that's going in their head. Cancer, I gotta go do this again, cancer. And I even told one of the nurses, they should bring in service dogs. Get somebody in here to do some jokes or get something, liven up the people a little bit. Give them some levity. You gotta laugh. I mean, it's like I said, if all you're gonna do is focus on what your ailment is, and cancer in this case, I'm not gonna say that this is the thing you should be doing regardless. I mean, there are some people that have really serious medical issues, but you need to stay positive. Always stay positive and learn to at least laugh now and then, because it's amazing how much it can help you physically and mentally if you make jokes, tell dad jokes, tell mom jokes, tell daughter jokes, Sometimes the more stupid they are, the more funny they are. But I'm not being stupid and goofy and laughing just because it's these kids. No. This is for me. And the message that I'm trying to give is for everybody else to be more positive. So, thank you for watching. Take care. I'll see you next time. And thumbs up. Smash that thumbs up. And don't forget to ring the bell for notifications and subscribe. And don't get the video out to more people. With all that said and done, is about it. Take care. God bless. See you next time.